I really am kind of passionate about how communication works, not to replace the human element. The people who are paying for it want to make sure that the service is being delivered. Biggest fear in the use of AI is that it won't be individualized among all of the people who touch the client. We have AI emerge that we use it as a tool for communication because fraud, waste, and abuse has always been an area of concern. Do you want to help and advocate for responsible regulation?
So we can start this digital interview. The way we do it is we have a digital magazine and we also have these bytes that we can use to project the world. In that process, we have you have your presence, right, in our ecosystem, in our community and network. And maybe, we can do have a more concrete partnership among us too, not just information exchange. Because at the end of the day, if we provide some value to our patient community, our ecosystem of vendors, as well as the payer network, including the public policy and influence and being advocates, I think that will make a difference, right, with our contribution. So go ahead, Rosalinda, introduce yourself. I see that your journey started way back, and you have been at the forefront of public policy, as well as as I see it, you've been part of boards. Regulation and policy has been part of your cadence. So you've been driving that, because especially when you talk about Medicaid and Medicare for senior population, how you can be part of that influencing mechanism with the government, and you be the bridge, right, when you're setting up policies. So how did you even get into that world to start with? Was there any personal anecdote that you we can share that drove you? Because you need to, it's not all about money, right? When you make career choices, it's something that you want to be passionate, that you feel good about, that drives you in that direction. So how did that began for you, Rosalinda? And then we can dive into specifics that we talked about in the context of where we are, and how we can leverage your experience and expertise.
Okay. So, yes, I did start a long time ago, and my first role was in direct care in state hospitals. So, the state of Texas has mental health hospitals that are run by the state. And I was doing direct care for individuals who were of age, geriatric populations, but also children in pediatrics and adolescents. And then, honestly, I was working nights, and I felt like I was just out of touch with my friends and family. And so I wanted a day job. And I didn't want to leave my, state comfort, knowing that I was going to get a check every month. And so I went to work at what was then healthcare regulation, where we were regulating hospitals and abortion clinics, and not home health at that point, but it was other types of long-term care. I left that specific location. Throughout my 33-year journey, I worked in a number of different places within the state system. And then I came back to what is home health and long-term care. So nursing facilities, home health, hospice, personal assistance services, and personal care, and day activities care services in 2000. Like right at 1999. Yeah. And then stayed with that because I loved working and providing, guidance in that space. And here's why: home health really touches all of the other locations where services and care are provided. there's a lot of strong communication with hospitals when a person is being discharged or going to the hospital and coming home, when they're in a nursing facility and needing care there. But home health and hospice are providing services in that location. I think that if you look at my journey, I really am kind of passionate about how communication works among all of the people who touch the client, even if it's peripherally with billing, how they touch the client and how they affect the client. So I've always been really passionate about that and how important communication is among all of the levels of healthcare that a client has to tap into in that coordination of care and continuum of care. So that's where I've really been very passionate about it. I love the legislative session. I don't love the hours when I was working for the state, but I love watching policy be developed and analyzing policy. And then also, I like being in the room where it happens. Yeah, I'm sure you're in the same way, right? You want to be there for those critical conversations and feed them. That's why I serve on the board for Texas and New Mexico Hospice. I really want to help to shift thinking around palliative care and supportive palliative care in Texas and hospice services.
Wow. Excellent. 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 So yeah, are you still part of the board member of Texas?
I am currently serving on the board. So I finished 1 year. When I retired from state employment, I couldn't engage for ethical purposes in the industry for the first year. And so then I started doing consulting after that first year.
Got it. Got it. Got it. Got it. Excellent. Excellent. Yeah. So it's interesting. You brought up two key things. One is communication, and second is being part of the ecosystem where regulation and being part of those sessions, right? Incidentally, I was up there in the Home Care Innovation Forum in Napa Valley last month, a couple of months back, and Debbie Stabaro was on the virtual meeting with us, and she's about to retire this year, right, as a senator. So she's a big healthcare advocate, and how she was advocating, and even in her last year of service, she's so passionate about bringing about change in healthcare, and also home care was part of, and hospice was part of her agenda. So she's striving. So it's very interesting to see how government how you can influence government with various organizations externally, right? So these bodies of NAHC, HCOA, individual state chapters have to really fight it out, literally, right? There's the tax dollars that are being allocated within the healthcare bucket, but there's so many nitty-gritties that have to go, and they have to fight it out. And so I would love to know, starting with communication, right? We really strongly believe, even in our world of AI and automation, if we can do even small 5%, 10% effective change with our automation engine or AI engine to streamline communication within a provider ecosystem or outside, when the provider, hospital system or clinic or home care agency is talking to their clients, or they're communicating with the payers, or with communicating with the government or CMS. How can we enable that easier using technology, right? So was that part of the conversation or conversations where communication could be more, in the good old days when we were all growing up, the only means of communication was go and meet that person, not even phone, or write letters, right? Those postcards, and then we just wait. That's it. So I think those days are gone now. Now, though those days were very good, when you meet a person, you feel good about it. And that's where it has taken full 360 degree. Home health is all about that now, right? There's some amount of virtual care and telehealth, but nothing can beat home care when it comes to somebody comes and gives you that service,
Yeah,
right?
I definitely want to constantly reiterate and remind people that home care is personal care. It's face to face in the person's location where they need services most. Yeah,
Yes.
I think that AI can augment that. Because of course you can't be in the home 24 hours a day.
Hmm.
And I think that one of the exciting things about AI being there is those smart solutions that can give a continuous feed of data or information that then the healthcare professional can act on after doing some analysis. But I have to admit, Shiva, that I am and did I get that right? Is it Shiva or
Shiva is
Siva?
fine. Shiva is
Oh,
fine. Shiva. Yes, yes, yes. You're
thank
right.
you.
Uh-huh.
I have to admit that I, from being a regulator,
Hmm.
have a cautionary tale around the use of AI because
Right.
as it emerges so quickly, we still have to remember that we're still serving baby boomers
Hmm.
who don't trust
Yes.
automation,
Yes.
and we're still serving, you're starting to serve some of those people like me who are in Gen X who
Hmm.
may embrace the automation more but still want a service.
Yes.
So right, and so it's I think I do have that thought that as we have AI emerge, that we use it as a tool for communication, not to replace the human element of healthcare. Yeah.
Absolutely. That's very well said. Because at the end of the day, when somebody is providing a service to you at home, whether it is, taking to the bathroom, right? Basic things, sitting by your bedside and talking to you, how you're feeling. Nothing can replace that. It is, forget about even home health coming from somebody, caregiver coming in, even your family, when, I'm also a Gen X like you, right? 70s born. So, so even now, even though we are tech savvy as much as not as much as our kids are, but enough,
Mhm.
we still want our, and my kids have gone, left home. I still want them to come for holidays and spend time with us. If I'm not well, or if I have, let's say I have to go through a surgery, and I know I will have care from the hospital system but I need my kids around me,
Mhm.
to be just by the side, just their sight, um,
Right.
next to me. They don't have to talk to me.
Mhm.
It makes a huge difference. It's yes, it's my child, my family next to you. So you are absolutely right, Rosalinda, that it's a human tendency that humans are social animals, right? Like any other animal. So you cannot bypass that. And technology and AI are just augmenting that experience, but not replacing it. And I think, yeah, like you said, if now I'm going to transition to how regulation has helped, to make sure that it doesn't cross those barriers, cross those lines, right? So,
Mhm.
what has been your recent experience of working with the Texas Commission, as well as the government, where, when and COVID was such a big catalyst, if I say, for induction of technology, because there was no way people could meet each other for care. So there had to be something remote that had to be, included or induced, forcibly, right? So how do you see this emerging from pre-COVID, COVID, and post-COVID days, where government has a role to play, including advocacy, influencers like you, and create that balance, right? Um, I'll tell you an example. My cardiologist, I used to have appointments during or immediately after COVID for telehealth, where I don't have to drive an hour to see my cardiologist for just a regular appointment to go through my results. They're not doing that anymore. They've stopped that. They're saying you have to come in the office. And they said it's the government has dictated, they're not going to get paid if they have overuse of telehealth, because maybe there's a lot of fraud going on. Maybe there is abusing that technology element. So how do you see this balance that we have to go, and your view of, meeting in the middle at the same time reaping the benefits?
So, I was, obviously, because I only retired 2 years ago.
Mm-hmm.
And so I was in the thick of things from a state perspective and government perspective during the pandemic. And so absolutely, when you're reacting to a global pandemic that is affecting everyone and every industry in various ways, and in some ways that, we had all thought of and others we just hadn't considered yet, there had to be the allowance for providers to react to the emergency and then to see what worked for them, given their staffing levels, given their clientele, and how they could do that with some parameters that we, at that time we adopted rules immediately and in an emergent situation, and then allowed them to, have guidance, weekly meetings, that kind of thing. Now, I can't speak to how the state is approaching, or the feds at this point are approaching telehealth, but I can say that because fraud, waste, and abuse has always been an area of concern, that the people who are paying for it want to make sure that the service is being delivered. That's where you get electronic verification systems.
Yes.
Right? For visits, and where you get that a face-to-face visit has to take place in order for a payer source to pay for it. And so now, from the standpoint where I sit now as a consultant, I do want to help and advocate for responsible regulation that is thoughtful, that considers the client, considers, the heart of healthcare, and makes it available for people when it does make sense. And so I hope that we can have more of those conversations going forward. I think the problem now is just, it's going to take time. I'm sure you see how long it takes to get a new set of legislation passed. And so it is going to take time. And an interesting aspect of that, speaking about automation and AI is just soaring at a trajectory that is at a level that's, much steeper than any incline you might see in regulation.
Yes. Yes.
And so it's interesting to follow, but that's kind of, I think, the quandary. Like, how do you temper something that can, really benefit people while placing regulatory constraints that make sense?
Absolutely.
Yeah.
No, other thing that comes to my mind while we are talking through, Rosalind, is that costs, right? So you see that regulation is, why do you think government will jump in and act on regulation? Because the less taxpayer dollars are consumed for same type of service in a setting that is helping the experience of the patient. And for example, one of the KPIs is how do you reduce hospital readmissions, right? So is AI technology helping that process? At the same time, is the care cycle experience is good for the patients, and the patient is getting treated and is happy. So it's creating that balance, right? So talking about costs, right? US healthcare system has always been probably one of the top 10, if not five, the costliest systems in the world in terms of the money that's spent on healthcare from from the patient side, whether it's coming through a payer source or from directly from patients' pockets, because there are so many layers and layers and layers that are tied to it, and things are not thought through. So, do you think there is regulation, disruptive regulation that needs to happen, not just incremental, that will help reduce the cost of healthcare? Because not everybody can afford insurance. Even if they have, they will be limited, there'll be constraints around that spend, right? Even if it's coming from Medicare, or from a private insurance. So how do you see, what would be your recommendations based on your all years of experience to where are the areas we can hit on to reduce the costs of healthcare?
Well, that's huge,
It's a
right?
loaded question. Sorry.
It is a loaded question.
Yeah,
It is.
yeah.
I think, one of the things I would start with is boosting and supporting provision of care at home. There's a statistic that says that for every individual who receives their care at home versus in a hospital setting and having an admission to a hospital setting, there's a cost savings of $7,000 for that patient alone, just by having them receive that care in their home-like environment. So that can be at a nursing facility, or it could be in their own home, or their family's home, or a group home. Something that doesn't require a license, or an assisted living facility, and boosting that availability of care and augmenting it there. And so that definitely has always been a talking point around cost savings. And just looking at how much home care can reduce costs. I think some of the other things would be time taken. If you are looking at the ability to chart and do your documentation at bedside in a more efficient manner, that absolutely can reduce costs, because you're not paying for nursing time that's spent, after hours or during other times when charting would be necessary. So if I'm putting some parameters around just home care, those might be the places that I would start with.
Absolutely. And we are already seeing those signs, right? Where there's regulation that's acting on having additional budgets for funding for home care, which is a good sign. But then there is regulation that's happening around payment more so than the industry itself, right? So where they're, like you said, they want to verify every visit, like EVV. Every state has guidelines now, including signature matching to actual verifying the visit, which these are all good things. So the regulation can first is allocate larger fund for this home care, home health, to again within that regulate the environment in such a way that there is no abuse and there is visibility of the care. That will help. Absolutely, absolutely. So now I will move on probably to the last question. Rosalind, is you're like you said, you're a consultant now, right?
Yes.
So when you are a consultant, you're neutral to the entire ecosystem. You don't want to be biased, right? So how do you see the industry moving in the next 3 to 5 years? And as a consultant, where do you want to really now spend your time and energy? As where you think you can make still your personal contributions. There are obviously, in the regulation side and or being part of these associations, or working with providers directly as a consultant, or vendors who are enabling virtual care, telehealth, and using technology and AI? Or is it the combination of this? Where does your heart lie moving forward? I'm sure you now, but after you became a consultant, you suddenly feel like you're starting your career all over again.
It really is very much
Yes.
like that. Yes.
Yes. Yes.
And I can tell you, and it right now, Shiva, it is a amalgamation of all of those things.
Yes.
So I do have clients who are healthcare, home care agencies.
Mm-hmm.
I do participate on the board. I don't speak for the board. You'd have to, talk to Texas and New Mexico directly for that. But I do participate, and I am speaking often at their engagements, as well
Excellent.
as doing training for Texas Association for Home Care and Hospice. And I think that one of the areas that I am most passionate about is just in time training.
Hmm.
And that's what I really, when you guys reached out to me, I
Mhm.
wanted to point that out very strongly,
Sure.
because as you're building systems in order to support automation and the use of AI, it would be wonderful if you build in just in time training opportunities for the person. Because again, my biggest fear
Mm-hmm.
in the use of AI is that it won't be individualized. You'll
Mm-hmm.
wind up with cookie cutter plans of care, cookie cutter documentation,
Mm.
that there might be the risk of one voice in AI.
Mm-hmm.
And,
Mm-hmm.
I'm really concerned about that, especially, you live in Texas. We are a very diverse
Yes.
area of the country. And when you reach across the country, that really is the case everywhere. And so you want to make sure that the voice of the AI can still reflect the voice of the client
Mm-hmm.
and that client's individual needs. And so I would love to see built into these systems more of those tools and toolboxes that give a person immediately, hey, I've entered something that has some problem, and give them pop-up of individual information. And hey, here's to strengthen your task or strengthen your functioning in that documentation. Wouldn't that be great? And so I can't say yet that I want to put my feet, soundly, firmly in one of those areas, because I think they're all necessary. We have a state legislative session that's coming up. That's
Mm-hmm.
going to be in January.
Yes.
And I'm looking forward to advocating where necessary for the industry. And so I also will be doing that to the extent that I can, following new regulations that are coming out, hopefully, for these industries from the state. So I've been still making comments whenever things come out. So it's interesting that you asked that question, and honestly, I can't say that I'm ready to go into one or the other yet.
So I think we are kind of wrapping up, but yeah, absolutely. You said it right, where your heart is in multiple places. So and you cannot let go of one area, because you've been part of that conversation in the past, and it's a holistic approach to doing things anyway. So you cannot ignore, right? Even if it's a provider or a vendor like us, you know, we have to understand what the provider is going through, what the patient clients are going through. We cannot, just like you said, we cannot box a solution. And you said it so eloquently well, Rosalinda, that just-in-time training just hit me, that you're passionate about, and I could see you helping us in that front in the future, because we are not we are not in the clinical world, right? We are in a technology world, and you could be the bridge for us when it comes to training, enablement, transition from a manual system to an automated system, operations, um, and then staff getting enabled in use of AI and technology. So those are the things that I could think right off the bat, see where you can help us too in the process. So thank you again for your time. It was a pleasure talking to you. Though we don't know each other, it looks like I know you somehow for some time. So this is very nice. That's what happens when in the healthcare world, we are able to relate to things so very well. just because
Really?
we are so embedded in the system. We just hit it off right away. Unlike other industries, right?
Mm-hmm.
It's so hard, and it touches humans here, right? It touches care. It touches all generations. I mean, we talked about pediatrics to senior care, right? It's the life of a
Right.
person.
It is indeed.
So it's like how can you forget? And then from Gen X's to baby boomers to Gen Zs, there's care,
Absolutely. And they
type of
all
care
want
need.
services in a different way. Yeah.
Absolutely.
I think, probably the last thing that I'd want to leave you with is,
Sure. Go ahead.
um, if you look at the continuum of care
Mhm.
and the big picture and all these pieces and facets that go into it, if you don't constantly have your gaze to the larger picture, then you
Mhm.
can lose sight of one or another of those perspectives. And you can't ever approach this from just one perspective. It has to be not what I need as a consultant, not what you need as a vendor, not what the client needs from the bed or even the agency that's providing the service. It's really, or the person who's paying for it. We can't
Yep.
leave them out
You
too.
can leave them out. Yes.
Right. It's
Yeah.
really the big picture, and that's how you lead from the heart
Yeah.
of the matter, right?
Yeah. Yeah.
So I think that, yeah, that kind of coordination and assistance and camaraderie with people who are vendors like you, I'm looking forward to that opportunity.
Thank you. Thank you. Same here. Looking forward, Rosalind. We'll continue this conversation and look forward to meeting you in a couple of weeks in Austin as well.
Okay. See you then.
See you then. Thank you
Bye.
again. Have a great day.